Here it is. This is important. If you're a senior woman and you've ever found yourself rushing to the bathroom, maybe not quite making it, or just living with the constant anxiety of a little leak, then this video isn't just for you. It's critical. Doctors are sounding a serious alarm, and frankly, 99% of women are completely unaware of the daily habits quietly sabotaging their bladder health, leading to those frustrating, embarrassing moments. What if I told you that the very things you're doing right now, possibly even thinking are harmless, are precisely what's making you wet your pants? We're diving deep into 8 habits you absolutely must avoid, starting today, to reclaim your confidence and control. Stick with me until the very end, because the last habit is the silent killer that most women overlook, and missing it means you'll be stuck with this problem for life. Neglecting muscles. Let's be honest, as we age, our bodies change. Gravity, childbirth, hormones, they all take their toll. But there's a pervasive, almost whispered habit among senior women that's incredibly damaging. We often completely neglect the very muscles designed to keep us dry. We chalk it up to just getting older, a natural decline, and simply accept that our pelvic floor is destined to weaken. This isn't just a misconception, it's a dangerous dismissal of one of the most powerful tools you have against incontinence. When you ignore those crucial muscles, they don't just weaken, they effectively go on vacation, leaving your bladder unsupported and vulnerable. Think of your pelvic floor like a strong, resilient hammock that supports your bladder, uterus, and bowels. It's a complex weave of muscles, ligaments, and connective tissues. Every time you cough, sneeze, laugh, or lift something heavy, those muscles are supposed to contract, providing a firm, protective barrier. But when you don't actively engage or strengthen them, that hammock starts to sag. It loses its elasticity, its strength, its ability to snap back. This isn't a passive process, it's an active decline fueled by neglect. Our bodies are designed to adapt and strengthen in response to demand. If there's no demand, there's no strength. It's that simple, yet profoundly impactful. The real insidious part of this habit is how it creeps up on you. You might notice a tiny leak when you sneeze, then a little more when you laugh, until suddenly, a short walk or a quick turn can trigger it. Each small incident chips away at your confidence, forcing you to adjust your life around it. You start planning your outings around bathroom availability, avoiding certain exercises, maybe even rethinking social engagements. This isn't freedom, it's a slow surrender to a preventable problem. Many women think that once these muscles weaken, it's a lost cause. That's a myth perpetuated by a lack of education and a culture that often shames women for talking about bladder issues. But here's the game changer, the insight that can truly turn things around. Your pelvic floor muscles are just like any other muscle group in your body. If you went to the gym and consistently lifted weights, your biceps would grow stronger. The same principle applies here. Consistent, correct engagement of your pelvic floor muscles, often known as Kegel exercises, can rebuild that strength, improve tone, and dramatically reduce or even eliminate leaks. The why is rooted in neuroplasticity and muscular adaptation. When you activate these muscles, you send signals to your brain that strengthen the neural pathways, making them more responsive. You literally retrain your body to do what it was designed to do. Now, I know what you might be thinking. I've tried Kegels, they don't work. And that's often because they're being done incorrectly. Many women mistakenly clench their glutes, abs, or inner thighs rather than isolating the pelvic floor. It's about a gentle lift and squeeze, as if you're trying to stop the flow of urine and simultaneously pull something up inside your body. It's a subtle but powerful movement. The trick isn't just doing them, it's doing them right and consistently. Integrate them into your daily routine. Do them while waiting for coffee, watching TV, or even driving. Make it a non-negotiable part of your day, like brushing your teeth. Your body will thank you, and your confidence will soar as you begin to feel that inner strength return, allowing you to laugh, sneeze, and live freely without fear. This isn't just about avoiding a problem, it's about reclaiming your vibrant life. Ice, poor hydration. This next habit is truly a silent saboteur, often misunderstood, and frankly, completely counterintuitive for many senior women. We're talking about poor hydration, but not in the way you might think. It's not just about drinking too little. It's also about drinking too much of the wrong things, or even too much plain water at the wrong times. The widespread belief that drinking less means peeing less is a dangerous myth that senior women often fall prey to, and it sets off a cascade of problems that lead directly to wetting your pants. Let's tackle the drinking too little part first. When you restrict your fluid intake, your urine becomes highly concentrated. Think of it like a very strong acidic cleaning solution. This concentrated urine acts as a potent irritant to your bladder lining. It's like pouring vinegar directly onto a sensitive surface. It stings, it inflames, and it makes your bladder hyperactive. Your bladder, sensing this irritation, will signal to your brain that it needs to empty, and it needs to empty now. This leads to increased urgency, more frequent trips to the bathroom, and a higher risk of urge incontinence. That sudden, overwhelming need to go that gives you no time to reach the toilet. Moreover, chronic dehydration can lead to constipation, which we'll cover in more detail, but suffice it to say, a full bowel presses on the bladder, exacerbating existing issues. Now let's flip the coin to the drinking too much aspect, or rather, drinking the wrong things. Many senior women, trying to be healthy, might inadvertently overdo it on bladder irritants. Caffeine, found in coffee, tea, and some sodas, is a diuretic, meaning it makes you produce more urine. It also acts as a stimulant, which can irritate the bladder muscle and make it contract more frequently and forcefully. Alcohol, similarly, is a diuretic and a bladder irritant. Even some healthy beverages like citrus juices, orange, grapefruit, or carbonated drinks can trigger bladder spasms for sensitive individuals. Consuming these in excess, especially later in the day, is a direct pathway to nighttime urgency and those dreaded morning leaks. The why behind this lies in the intricate interplay of osmoregulation and bladder neurobiology. Your kidneys work tirelessly to filter waste from your blood and maintain a delicate balance of electrolytes and water. When you're dehydrated, your body conserves water, leading to that concentrated urine. When you consume irritants, their chemical compounds directly affect the nerve endings in your bladder wall, triggering an exaggerated response. It's not your bladder's fault. It's reacting to the environment you're creating for it. The actionable insight here is not to stop drinking water, but to hydrate smarter. Aim for clear, pale yellow urine throughout the day, which indicates good hydration without overdoing it. Spread your fluid intake evenly across the day, sipping water consistently rather than chugging large amounts all at once. Reduce or eliminate caffeine and alcohol, especially in the afternoon and evening. And here's a tip most people miss. Try to front-load your hydration. Drink more earlier in the day and taper off a couple of hours before bed. This allows your kidneys time to process the fluids before you lie down, significantly reducing nighttime bathroom visits. Remember, a well-hydrated, non-irritated bladder is a calm bladder, and a calm bladder is a controlled bladder. This isn't about deprivation, it's about intelligent, mindful hydration that supports your body's natural rhythms and helps you stay dry and confident. Irritant indulgence. Following on from our hydration discussion, this habit takes a deeper dive into the specific culprits lurking in our daily diets and routines that silently provoke our bladders. Irritant indulgence, that's what we're calling it. It's the unwitting consumption of certain foods and drinks that act like tiny little provocateurs, constantly jabbing at your bladder, making it twitchy, overactive, and ultimately prone to leaks. For senior women whose bladders may already be more sensitive due to hormonal changes and age, these irritants become even more potent, turning minor sensitivity into a full-blown urgency problem. We touched on caffeine and alcohol, but let's be absolutely explicit about their impact. Caffeine, found in your morning coffee, that afternoon tea, or even in some pain medications, isn't just a diuretic that makes you produce more urine. It's also a bladder stimulant. It tells your bladder muscles to contract more frequently and more forcefully, even when it's not very full. Imagine a child constantly poking you. Eventually you'll snap. Your bladder is no different. For many, a single cup of coffee can set off an hour-long cycle of urgency. Alcohol, on the other hand, impairs the signals between your bladder and brain, making it harder to recognize when your bladder is full or to hold it. It also causes dehydration, which, as we discussed, makes urine more concentrated and irritating. But the list of bladder bullies doesn't stop there. Many women are shocked to learn that some seemingly healthy foods are actually major bladder provocateurs. Citrus fruits and juices, lemons, limes, oranges, grapefruits are highly acidic, and this acidity can irritate the bladder lining, triggering urgency. Tomatoes and tomato-based products, sauces, ketchup, salsa, are another common culprit due to their acidity. Spicy foods, with their capsaicin content, can also ignite bladder irritation, creating a sensation that mimics a urinary tract infection without the actual infection. Artificial sweeteners, often found in diet drinks and many processed foods, are notorious for their bladder irritating properties for some individuals. And let's not forget carbonated beverages. The bubbles themselves can distend the bladder and trigger contractions. The why behind this is complex, involving both chemical irritation and neurological hypersensitivity. The bladder lining, or urothelium, is not just a passive barrier, it's a sensory organ lined with nerve endings that detect chemical changes and stretch. When acidic, spicy, or chemically irritating compounds come into contact with these nerve endings, they send exaggerated signals to the brain, interpreted as urgency or discomfort. Over time, constant exposure can make the bladder more hypersensitive, leading to a vicious cycle where even small amounts of irritants cause significant symptoms. The actionable insight here is a bladder elimination diet. This isn't about permanent deprivation, but about becoming a detective in your own body. For a week or two, eliminate all the common irritants: caffeine, alcohol, citrus, tomatoes, spicy foods, artificial sweeteners, and carbonated drinks. You might be amazed at the difference. Then slowly reintroduce them one by one, giving each food item 2 to 3 days. Pay close attention to how your bladder responds. This personalized approach empowers you to identify your specific triggers. You might find you can tolerate a small amount of coffee in the morning, but absolutely no orange juice. Or perhaps spicy foods are fine, but anything with artificial sweeteners is a definite no-go. This isn't about rigid rules. It's about informed choices that allow you to enjoy life and food without constantly worrying about your bladder. By recognizing and avoiding your personal bladder bullies, you reclaim control and significantly reduce your risk of those unwanted leaks. This knowledge is pure power, allowing you to curate a diet that supports a calm, happy bladder. Bladder mismanagement. This habit is perhaps the most insidious because it involves what seems like logical, even helpful behaviors that actually wreak havoc on your bladder's natural rhythm. I'm talking about bladder mismanagement, specifically 2 common patterns: holding it too long and, just in case, peeing. Both, while seemingly opposite, disrupt your bladder's ability to store urine effectively and correctly signal when it's truly full, directly leading to an increased risk of wetting your pants. Many senior women fall into one of these traps, unknowingly training their bladder to be dysfunctional. Let's start with holding it too long. When you consistently ignore the initial urge to urinate and hold your bladder beyond its comfortable capacity, you're essentially stretching the bladder muscle beyond its natural elasticity. Over time, this can desensitize the nerve endings in the bladder wall. Your bladder eventually gets so stretched out that it loses its ability to contract effectively when it is time to go, leading to incomplete emptying. More importantly, it can stop sending clear signals to your brain about its fullness. The initial gentle, "I need to go soon" signal gets ignored, and then suddenly, without warning, it's an overwhelming, "I need to go now." This rapid escalation gives you very little time to react, leading to urgency and, inevitably, leaks. Chronic overdistension can also weaken the bladder wall itself, making it less efficient and more prone to problems. On the other end of the spectrum is just-in-case peeing, also known as safety peeing. This is when you go to the bathroom just in case, before you leave the house, before a meeting, or even every hour on the hour, regardless of whether you actually feel the urge. While it feels like a proactive measure to prevent accidents, it's actually incredibly detrimental to bladder health. When you constantly empty a bladder that isn't truly full, you're training it to hold smaller and smaller amounts of urine. Your bladder never learns to stretch to its full, healthy capacity. It becomes hypersensitive, signaling an urge to go even when it only has a small amount of urine. This reduces your functional bladder capacity, meaning you'll feel the urge to go much more frequently, creating a vicious cycle of constant bathroom visits and persistent anxiety about not being able to make it. The why behind these issues lies in bladder retraining and its disruption. Your bladder is a remarkable organ designed to fill gradually, send signals to your brain when it's about 1/3 to half full, a mild urge, and then hold comfortably until it's nearly full, a strong urge. Both holding it too long and just in case, peeing, interfere with this natural cycle. Holding it too long blunts the initial signals, while just in case, peeing trains your bladder to react to very small volumes. In essence, you're sending mixed messages to your bladder, confusing its natural rhythm and response mechanisms, making it unpredictable and unreliable. The actionable insight here is bladder retraining. This is about consciously re-educating your bladder to hold more urine and to respond appropriately to its signals. If you're currently going every hour, try to extend that interval by 15 minutes. Use distraction techniques, focus on a task, read a book, deep breathe, to push through the initial mild urge. Gradually increase the time between bathroom breaks. For just in case peers, consciously resist the urge to go unless you truly feel your bladder is at least half full. The goal is to get to a point where you're emptying your bladder every 3-4 hours during the day with minimal urgency. This takes patience and consistent effort, but it's incredibly empowering. By consciously managing your bladder rather than letting it manage you, you'll rebuild its capacity, restore its natural signaling, and gain tremendous confidence in your ability to stay dry, no matter what your day throws at you. This isn't just about managing leaks, it's about taking back control of your daily life. I know, dietary neglect. Let's talk about something incredibly common, deeply uncomfortable, and profoundly impactful on your bladder health, especially as a senior woman: dietary neglect. Specifically, I'm referring to a diet that contributes to chronic constipation. While it might seem unrelated, ignoring your digestive health and consistently struggling with constipation is one of the most significant yet overlooked habits that can directly lead to bladder leakage and increased urgency. This isn't just about feeling bloated or sluggish, it's about a physical pressure cooker in your pelvis. Imagine your pelvic area. It's a crowded neighborhood down there. Your bladder, uterus, and rectum are all close neighbors, sharing the same limited space, supported by the same pelvic floor muscles. When your rectum is consistently full and distended with stool, it acts like a persistent internal pressure balloon. This full bowel presses directly against your bladder, reducing its capacity to hold urine and making it feel full much faster than it actually is. It's like trying to fill a water balloon with a heavy brick pressing against its side. It can't expand properly. This constant pressure triggers an increased sense of urgency, making you feel like you need to run to the bathroom even when your bladder isn't truly full. But the impact doesn't stop there. The chronic straining associated with constipation puts immense repetitive stress on your pelvic floor muscles. Every time you strain to have a bowel movement, you're pushing downwards, which weakens those very muscles designed to support your bladder and keep you continent. Over time, this can lead to further pelvic floor dysfunction, including prolapse, where pelvic organs descend, and stress incontinence, where leaks occur with coughs, sneezes, or sudden movements. It's a vicious cycle. Poor diet leads to constipation, which puts pressure on the bladder and weakens the pelvic floor, which then exacerbates incontinence. And the unfortunate truth is, as we age, slower gut motility and certain medications can make us more prone to constipation, making this habit even more critical to address. The why is rooted in basic anatomy and physiology. Your rectum, when full, literally sits right behind your bladder. The nerves that supply your bowel and bladder are also closely intertwined. Irritation or overactivity in one can influence the other. So when your bowel is struggling, your bladder often struggles in sympathy. This often explains why some women find their bladder issues magically improve when they resolve their constipation. It's not just an improvement, it's the removal of a significant physical and neurological stressor on the entire system. The actionable insight here is simple yet profound. Prioritize your gut health with a conscious, fiber-rich, hydration-focused diet. This means increasing your intake of fruits, vegetables, whole grains, and legumes. Think vibrant colors and natural, unprocessed foods. Aim for at least 25-30 grams of fiber daily. Don't forget the hydration component we discussed earlier. Fiber needs water to work effectively and soften stools. Consider adding a natural fiber supplement if dietary changes aren't enough, but always discuss this with your doctor. Regular physical activity also stimulates bowel movements, so gentle walks or other exercises can make a huge difference. By making conscious choices to support a healthy, regular bowel, you're not just improving your digestive comfort, you're directly alleviating pressure on your bladder, allowing it to function optimally. This isn't just about avoiding a problem, it's about fostering an internal environment where all your organs can thrive, leading to greater comfort, control, and freedom in your daily life. It's about being kind to your entire system. Relying pads. This next habit is a tough one to talk about because it comes from a place of seeking comfort and security, but it often backfires spectacularly. We're talking about the insidious habit of constantly relying on pads, just in case, as a primary solution for bladder leakage. While pads certainly have their place for temporary or severe situations, making them your everyday, go-to solution for even minor leaks can actually worsen your bladder control and keep you stuck in a cycle of dependency, preventing you from ever truly solving the underlying issue. It creates a psychological and physiological trap. Think about it this way. When you wear a pad all the time, your brain and bladder effectively get a pass on doing their job correctly. The immediate consequence of a leak, the wetness, the discomfort, is buffered by the pad. This sounds good in theory, but it removes the crucial negative reinforcement that would otherwise prompt your brain to react more quickly or encourage you to seek out active solutions. Your bladder isn't challenged to hold more, and your brain isn't pushed to respond to urgency signals with the same immediacy. It's like wearing an arm sling for a minor sprain for too long. The muscles weaken because they're not being used. The physiological impact is also significant. Constant pad use, particularly with absorbent materials, can create a warm, moist environment against your skin. This isn't just uncomfortable, it can lead to skin irritation, rashes, and an increased risk of urinary tract infections, UTIs. UTIs in turn cause bladder irritation and urgency, further exacerbating leakage and creating a vicious cycle. The smell, the bulkiness, the constant awareness, all these factors contribute to a diminished quality of life, even if the pad prevents a visible leak. It's a constant, silent reminder of a problem you might otherwise be able to significantly improve. The why behind this habit's detrimental effect is rooted in both behavioral conditioning and the concept of learned helplessness. When you consistently outsource your bladder control to a pad, you're essentially telling your body that it doesn't need to try as hard. You might become less attuned to your bladder's signals because the consequences of missing a signal are mitigated. This can lead to a desensitization of your bladder's ability to communicate effectively with your brain, making it harder to recognize a true need to go versus a mild urge that can be suppressed. It also psychologically reinforces the idea that this is just how it is now, preventing you from exploring effective long-term solutions that could restore your independence. The actionable insight here isn't to ditch pads entirely if you truly need them, but to shift your mindset and use them strategically, not as a blanket solution. Think of pads as a temporary bridge while you actively work on strengthening your bladder control. If you're experiencing mild leaks, challenge yourself to go without a pad for short periods at home, especially when you're close to a bathroom. This forces your brain and bladder to re-engage, to listen to those subtle signals, and to react. Integrate those pelvic floor exercises diligently, practice bladder retraining, set realistic goals for reducing pad dependency. If you absolutely need a pad for a long outing, choose breathable, high-quality options and change them frequently to maintain skin health. The goal isn't to simply manage leaks with external aids. It's to reduce the leaks themselves from the inside out. By gradually reducing your reliance on pads, you send a powerful message to your body and your mind. I am capable of control. This shift in perspective is incredibly empowering and is a vital step toward reclaiming your freedom and dignity. Don't let a pad become a crutch that prevents you from walking again. Wrong exercise. For senior women, staying active is paramount for overall health, bone density, mood, and cognitive function. But here's a crucial, often overlooked habit that can actually worsen bladder control issues: engaging in the wrong types of exercise or performing exercises with poor technique, especially without adequate pelvic floor support. Many women, with the best intentions, participate in activities that put excessive downward pressure on their pelvic floor, directly exacerbating stress incontinence and even contributing to pelvic organ prolapse. It's an invisible strain that can undo all your other efforts. Consider high-impact activities like running, jumping, or even vigorous aerobics. Each time your foot hits the ground or you land a jump, a significant force travels up your body. If your pelvic floor muscles aren't strong enough or aren't actively engaged to counter this force, that pressure gets transmitted directly downwards onto your bladder and other pelvic organs. This downward pressure can cause urine to leak out, which is the very definition of stress incontinence. Repeatedly subjecting your pelvic floor to this kind of strain without proper preparation or support is like constantly hitting a weak spot. Eventually, it's going to give way. Furthermore, certain core exercises, while well-intentioned for abdominal strength, can also be problematic if done incorrectly or without pelvic floor awareness. Traditional crunches or sit-ups, especially with poor form, can create significant intra-abdominal pressure that pushes down on the pelvic floor. Instead of strengthening in a way that supports your core and pelvic floor synergistically, these exercises can actually weaken the pelvic floor by pushing it downwards. Many women are taught to suck in their stomach, which can sometimes lead to breath holding and excessive downward pressure. The key isn't to avoid core work, but to ensure it's integrated with proper pelvic floor engagement. The why lies in biomechanics and the delicate balance of intra-abdominal pressure. Your body has a natural pressure system within your core. When you exert yourself, whether by lifting, jumping, or straining, this pressure increases. Your pelvic floor is designed to be the floor of this pressure system, acting like a trampoline that flexes and rebounds, supporting your organs. But if that trampoline is weak, or if the downward force is too great, it sags, leading to leaks. Hormonal changes in senior women, like decreased estrogen, can further reduce the strength and elasticity of connective tissues, making the pelvic floor even more susceptible to these pressures.